To everyone who is watching this session, today we have with us Dr. Charan Teja Koganti, and today we are going to discuss about the depression in men. So let's start with the question, doctor. My first question to you is: what are the unique signs and symptoms of depression in men?
So, signs and symptoms of depression in men would be mostly similar to in women, except that there are also some additional symptoms. So, the normal symptoms would be, which are common for both men and women, would be obviously low mood, low interest in any activities, feeling easily tired or fatigued, lack of attention or concentration. Hence, they'll have difficulty recalling certain memory incidents, then increase or decrease in appetite, increase or decrease in sleep, then hopelessness, unworthiness. In severe cases, there will be suicidal thoughts. These are the common symptoms in both men and women. Whereas, especially in men, depression can also present with irritability. It's called agitated depression. So, normally we expect someone who is depressed to be quiet, isolated, withdrawn from people, maybe crying, feeling very sensitive, keeping to themselves, etc. But in men, it can present as they're very irritable, volatile, abusive, agitated. Even that can happen. That is one thing. Second is obviously they don't seek help, because of which the depression can get worse. And even though women tend to attempt suicide more than men, but the likelihood of completing the suicide is seen more in the men. So when it is severe, it is really severe in men. Not just that, in men with depression, they usually engage in risky behaviors. For example, gambling, drug abuse, risky driving that may cause accidents in either and harm self or other people on the road. These can happen in men. Yeah.
Okay, thank you. What does sociality stigma affects men's willingness to seek help for depression?
Of course, society always teaches. First of all, it's a patriarchal society that we live in, and most of the societies in the world are patriarchal, unfortunately, because of which men are traditional breadwinners of the family. So they're always motivated to feel strong and hold jobs. They can't take breaks. They have to fend for the family, take care of spouse, kids, elders, etc. Because of these traditional roles that men assume, they are always trained to not express their emotions. If they're feeling, especially if they're feeling low, they're not supposed to express. They have to somehow outgrow that feeling and get to their work. Because of which, even if somebody is in initial stages of depression, mild depression, they don't seek help. They don't even seek comfort or social support. They don't even talk to their spouse about it, because it is also considered very less masculine in a traditional society like our country, because of which the depression tends to get worsened with time, and it can lead to another medical condition such as drug abuse or accidents, like I just told you, or a completed suicide. These can happen. So societal conditioning plays a huge role. Forget about depression. Generally, also men are not encouraged to cry. Crying is a normal reflex. Where we all cry for things that are bothering us or things that are bothering our loved ones, even while watching a movie. But men are not encouraged. They always make fun of men who cry, who express. They're looked as very less masculine, etc. Yeah. So societal condition plays a huge role, if you ask me.
Okay, thank you, doctor. What are the common risk factors for depression in men?
Common risk factors would be, firstly is genetic. If you have any family member, especially first degree relative with depression, mood disorder, or even substance abuse disorder, that can also cause depression in men. Hypothyroidism. Usually hypothyroidism is mostly seen in women, but even if men have it, they can develop depression. Vitamin D deficiency, severe vitamin B12 deficiency, anemia, low testosterone. Low testosterone is one of the commonest presentation of clinical depression in men. These are few common conditions. Even drug abuse. If a man is smoking, drinking alcohol, it will change the brain's structure and function, hence causing clinical depression. These are few of the common conditions. And also, if you're undergoing any stressful life experience, be it in a personal life or professional life, that also can contribute to depression. Yeah.
Okay. How can depression in men may be effectively treated, doctor?
Uh, Firstly, we psychiatrists we assess and evaluate the grade of depression or severity of depression, based on which, if it's mild depression, it's mostly by counseling. But if it's moderate to severe depression, definitely we need to also add medications and also help them help. Uh, we have to also diagnose the underlying condition which may be causing depression. For example, if somebody is having severe vitamin D deficiency that is causing low moods, low energy, low sex drive, poor sleep, all of this, we'll have to also diagnose that and treat the primary condition also that is causing depression. So this way, we'll do counseling, medications, a group approach of all of this together that will help with treatment. Also, some social support changes. For example, we have to build a social support system for him where if a man is feeling burnt out and stressed out from earning for the family, we can encourage the other significant partner also to start working and help the man in taking care of the family. Certain social reformative changes also will help.
Okay, okay. Thank you, doctor. These are all the questions that I had for you. Would you like to convey any message to our audience?
Yeah, also I think November happens to be, I think, Men's Mental Health Awareness Month. So I want to urge all the men out there that men and women, there's no much difference. Even though depression is more common in women because of the hormonal predisposition, men are also almost at the equal number of risk as women. And with as we are progressing every year, the cases are only higher. So if you're seeing any decline in your performance at work, having any mood swings, irritability, sleep disturbances, easily gaining weight, not able to remember things, all this could be sign of underlying depression. So please reach out. Like any other medical conditions, earlier the treatment, better the response. Thank you.
Okay. Thank you. Thank you so much, doctor. It was very insightful session. Thank you once again, doctor.
Of
Thank you
course.
so much.
Take care.